Well, from our state capitol newsroom, Tennessee's 14 trauma centers are seeing more patients than ever. But the cigarette tax that helps cover certain costs is burning up. The funding helps support trauma centers, readiness expenses, and care for patients who don't pay. As News 2's Tori Gessner tells us, trauma centers are now asking state lawmakers for more money.
From badly broken bones to gunshot wounds, Tennessee's trauma centers are used to treating patients in critical condition. Now, they say they're fighting for their own survival, not physical, but financial.
The majority of the states in our nation have clearly defined trauma funding sources, Tennessee being one of them. But as we look at some of our neighboring states, you see that we're sort of trailing behind them.
While states like Virginia fund their trauma centers through vehicle registration fees, generating around $16 million a year, Tennessee pays for theirs through a cigarette tax. It went from generating around $9 million in 2008 to less than $6 million in 2023, as cigarette sales continue to drop.
As you can see there on the left, the trauma fund portion from cigarette tax alone has decreased remarkably over the last 10 years, while on the right you can see that the trauma registry count, the numbers of patients we see per year, has increased significantly. As a physician, I'm glad that less people are smoking. As a trauma physician, it hurts our resources.
The cigarette tax only covers about 6% of what it costs for Tennessee's trauma centers to be ready to treat patients. Right now, the hospitals are paying for the rest. Last year, the state dedicated an extra $5 million to help, but trauma centers say this year they'll need more money and a new source of funding.
What we talked about was $170 million in readiness. That doesn't, the costs of actually providing that care once they're admitted are tremendous. And as you can imagine, there are many patients who are indigent or underfunded. And so, no, we're not a profitable industry, but a necessary one for sure.
Reporting in Nashville, I'm Tori Gessner.
Now, the trauma centers also say there's been an increase in uncompensated care where hospitals treat a patient but never receive payment. Democrats have long said Medicaid could be a solution, but many Republicans have pushed back, citing concerns over the increased cost.